Medicare for all sounds good, but Democrats need to spell out exactly what they mean. Los Angeles T. Democratic politicians are increasingly bold about supporting a Medicare for all or single-payer health care system as a means of extending coverage to the tens of millions of Americans currently lacking insurance. But two things are quickly becoming clear as presidential wannabe, including Senators Kamala Harris and, first, no one other than Vermont Sr. Bernie Sanders has. This means voters will largely be left to guess how each candidate would pull off what he or she is promising. Second, Medicare for all advocates desperately need to work on their messaging, because they're allowing conservative opponents to frame the discussion with "sky is falling" fear tactics and outright lies. The Democratic plan would inevitably lead to the massive rationing of healthcare, President Trump. Doctors and hospitals would be put out of business, he said. Seniors would lose. Those dire predictions and Trump's warnings this week about socialism run amok would be laughable if the stakes weren't so high. Nearly 14% of Americans lack health coverage, the highest level in 5 years. We pay about twice. When Democrats talk about Medicare for all, they're not just trying to rally their political base. They're trying to address where they're falling short, at least so far, is in making that case to the nation in clear, precise terms. Prices for medical care services and administrative costs would likely be lower than the current system, Jean Abraham, a professor of healthcare administration at the University of Minnesota, told me. She was quick to add, however, that until there is an actual piece of legislation with specific benefit design provisions and offsets to pay for the legislation, it is not even possible to model what things would look like. Would a Medicare for all system mean the end of private insurance, or would it work in tandem with private insurance, as is currently the case? Are we talking about expanding the existing system to anyone who wants to join, without any age restrictions? Or are we talking of, would everyone be required to take part, or would participation be optional? Then there's the question of cost, which has quickly proved to be the easiest thing for opponents of healthcare reform to attack. For example, this figure is deceptive, however, because it doesn't reflect the way current healthcare spending would be incorporated into the new system. By some estimate, I've been particularly struck in recent weeks by news stories correctly observing that taxes would have to go up to fund a Medicare for all or single-payer system. What these stories almost always omit, though, is that higher taxes would replace the nearly $11,000 that Americans currently pay in average premiums, co-pays, and deductibles. Many economists, one could make the point that taxes would go up, and premiums and co-pays would likely go down, said Catherine Baker, Dean of the University of Chicago's Harris School of Public Policy. But she noted that whether you're better off financially will depend on your tax bracket as well as your current insurance. That's another way of saying that if you're in the middle class or at the lower end of the economic spectrum, you'd likely find single-payer both more affordable and more reliable than your current insurance. If you're at the top of the economic food chain, then it's entirely possible a single-payer approach would represent a step down from the gold-plated plan you now enjoy. I've looked at the various single-payer systems worldwide. The best system, known in healthcare circles as the Bismarck model after Prussian Chancellor Otto von Bismarck, who originated the idea in 1883, this approach relies on payroll deductions to fund non-profit insurers and requires that they cover everyone. It also sets base requirements for what must be covered and how much can be charged for treatment. The state plays an. That said, the Bismarck model leaves plenty of room for private insurers to compete by offering more affordable coverage to younger people, or additional benefits for those willing to pay more. I suspect this would be an easier sell for Democrats than a wholesale switch to, say, the Canadian system, which relies on the government to pay all medical bills. Use Medicare for all as the base and then allow private insurers to supplement the program. Just as important as clearly defining what's being proposed, political leaders must communicate the need for patience and maturity during any healthcare transition. If Obamacare, on average, utilization per person will go up, because all the uninsured will get coverage, and will therefore demand more care, observed Vivian Ho, director of the Center for Health and Biosciences at Rice University's Baker Institute for Public Policy. And if you get rid of the distinction between Medicare and Medicaid, she said, utilization goes up even more. Ho also warned that many doctors and hospitals will rebel if their reimbursement by a state-run or state-regulated insurer goes down from current levels, which it almost certainly would. They'll insist on standing up to such self-serving demands, and convincing the medical establishment that today's obscene profit margins are unconscionable, wouldn't be easy. Conservatives in particular would have to resist their usual knee-jerk response that the market can solve all our health care woes. If it could, the political right would need to commit instead to helping find common ground that works for all, in the best interest of the nation. To date, it feels like we're reaching some sort of inflection point, a national reckoning that our healthcare system doesn't function as well as desired and that changes are necessary. Happily, we know from the examples of other developed countries what works and what doesn't, and we have the luxury of building on the lessons they've learned. My suggestion: take politicians out of the equation and create an independent body to oversee our healthcare system, much as the Federal Reserve oversees monetary policy. Let's decide where we want to go and then rely on these independent, qualified experts to get us there, without all the histrionics and gamesmanship from those trying to score political points. Like I say, this is a process that would require levels of patience and maturity that Americans do not normally display. Agree or disagree with what's on the table, that's your prerogative. But if your only answer is to reject change because it's being proposed by the other side, or to leave well enough alone because the issues are too difficult to resolve, you have no business being part of the conversation.
Raindrops, drop top smoking, no cooking the hot pot. Fucking on your bitch, yeah, that. Looking up, open the park pot.